Welcome to the Doc Dudes, your premier podcast for a behind-the-scenes look at the latest in aesthetic medicine. Hosted by the cosmetic surgeons at Graper Harper Cosmetic Surgery in Charlotte, North Carolina, the Doc Dudes brings you interviews with insightful guests, expert tips from experienced medical professionals, and lots of laughs along the way. And now, here's Dr. Garrett Harper, Dr. Robert Graper, and Dr. Evon Zoog, also known as the Doc Dudes.
All right, welcome to another podcast episode of the Doc Dudes. I'm Garrett Harper, and I'm going to make the other guys say their names. So I am here with
Dr. Robert Graper eating pretzels.
Peanut pretzels. Those things are fantastic.
They really
Those
are
little
good.
pillows. They're amazing. And
Dr. Evon Zoog.
Love it. Awesome. Okay, so this episode, we are going to talk about all things guys. Now, apparently the title of this podcast is Guys Do It Too. Wow. Men in plastic surgery, skincare, Botox. And so as just kind of a brief introduction, you know, cosmetic surgery for men is one of the fastest growing patient populations that we're seeing, not only kind of internationally, nationally, but also in our practice. Men are starting to realize that their wives or their spouses are a lot better looking than they are.
And, you know, they better keep up.
And gosh darn it, we're not going to take it anymore.
Yeah.
You know what I mean?
Yeah.
And so as men strive to start living healthier, better lives, it's not uncommon for them to need some refinement, just like our female patients. So men
Well,
can...
wait a minute. They all need refinement.
Yeah,
they
that's
just have
very
to
true.
do it.
Very true. And so men can enhance their masculinity, minimize any aesthetic flaws they might have, and rejuvenate their overall experience by coming to see us.
Walk back the
That's right.
clock.
That's exactly
'cause
right.
The clock keeps ticking for
Yeah,
everybody.
Yeah. And as far as trends go, you know, it looks like 1.5 million male patients were seeking plastic surgery in 2022. So data that's a little old, but they only kind of give us that data every couple of years. So I'm sure we'll get some
What are the
more.
most common things men do?
Well, I think you got to break it down, right? I think we need to talk about skincare. I think we need to talk about Botox fillers, hair rejuvenation, and then I think we talk about procedures. From a procedural standpoint, it's got to be liposuction, right?
Absolutely.
I mean, just like kind of everything else, it's got to be liposuction, of course. You know, all three of us.
Gynecomastia.
Yeah, gynecomastia.
What is gynecomastia?
massive
Tell
weight
the
loss.
troops what gynecomastia is.
Gynecomastia, you know, it's not always, that term is kind of loosely used, like a lot of terms in plastic surgery. It's kind of a nebulous thing, but basically it's breast tissue for guys. And so a lot of guys, it can be minimal, right? It can be just little buds that they feel behind their nipple areolar complexes that they don't like, that maybe gives them puffier nipples than they want.
See through the T-shirts.
yeah.
Don't want to take your T-shirt off the
to
pool, the
full
lake,
on-
the beach.
Yeah, but we've got patients, you know, I mean, they've got pendulous breasts.
Yeah,
I mean, that
B
hang
cups.
down. Yeah. And
C
so,
cups.
and this doesn't necessarily, this isn't the guy that's, you know, 50, 60 pounds overweight. They need to lose weight, right? We tell our male patients the same thing that we tell female patients, right? I mean, when somebody comes in and you're seeing a consultation, Evan, and the guy comes in and he says, I'm 5'10" and I'm 275 pounds and I just want a liposuction every area of my body. I mean, what do you tell that patient?
It's not a weight loss procedure.
Right.
You got to lose weight.
Right.
Your risk of having problems is a lot higher when you're that weight.
Right.
But for gynecomastia, I've got a guy next week, young, 17-year-old
Yep.
male, and he just has some extra breast tissue. He's always had it. It
Right.
bothers the crap out of him.
Yep.
You know, he's in high school. He's a senior in high school.
Gets kidded all the time. I bet.
And he is so excited.
That's awesome.
Do you make an incision or you just lipo it? How do you handle that?
There's several different thoughts, but typically I'll do liposuction and an incision
To get out the more fibrous tissue.
to get out the bud, the breast bud,
Okay.
that hard disc behind
You know, I
them.
think with ultrasound, you know, vaser therapy, that kind of stuff, which vaser therapy is, it's pre-liposuction, right? Like to mess the area that you're going to remove fat and some gland.
To mess.
So to mess is a mixture of normal saline, salt water with lidocaine, which helps with pain relief, and epinephrine.
That
which
lasts,
is gonna cause
a
some
day? So there's
vasoconstriction.
no pain for a day or more?
Yeah, I mean, pain with liposuction, especially even with chest liposuction, and if it's a glandular thing, you got to use the Vaser. And the Vaser is just going to use a different energy source to kind of really separate the fat from any of the surrounding tissues and structures and just makes it less violent to bring it out, right?
Do you find that you still have to make an incision to get the fibrous out, or can this Vaser get that as well?
Yeah, it can
melt
get it. It can get it. It can melt it. Everybody's a little bit different. Some people have, I mean, this is a gland, right? I mean, this feels like a little thing, a silly putty underneath there. And so you do have to make an incision in order to get it. And I've made incisions the bottom half of the areola. I've had areas that are big enough, hard enough, firm enough to where you're making an incision in their inframammary fold to be able to get this out. Their areola is just not big enough. And I don't want to put anything, directly on the center of the chest on a guy. I mean, sometimes our incisions on men are a little easier because they have chest hair, right?
But typically,
some guys shave their chest.
Hidden around the areola.
Oh, it's beautiful.
And
hidden.
they don't really, it's
Correct.
a huge beneficial trade-off.
Oh, I think that's great. I just mean if they've got a really large lesion that I can't get through a smaller areola, I don't want to hockey stick the incision out laterally or anything like that.
And that's really rare.
Yeah, very rare.
95% of the time you can.
Yeah, just
for
some
the
1
areola.
centimeter incisions for the liposuction and maybe an incision in the tissue change
Right,
between the
but
areola and the...
I think what you're talking about are the patients that have, grade 1 or grade 2 ptosis. Of course, like everything in medicine, it's graded on, not so bad, or we've got a hanging pendulous breast, the nipple's nowhere where it needs to be. And so that's a total different approach. I mean, Evan had one, I think the other week where do a free nipple graft on some of these patients, right? You literally physically take their nipple areolar complex off of their body, thin out the tissues underneath it, cut off whatever excess you need to as far as skin goes. Because one thing you don't want to do is you don't want to do typically a feminizing, kind of breast reduction, breast lift on somebody. And so if you're really, guys don't want projection and perkiness to their breasts like women do, right? They want the exact opposite. So seldomly are you giving a guy the same kind of incisional pattern that you would give a female. So for those patients, they typically wake up, your patient that you did a couple weeks ago is a massive weight loss patient, what incisional pattern do they wake up with for their chest?
Yeah, so he's actually 4 weeks out now. Yeah. And so we did an upper body lift and free nipple grafting and a circumferential lower body lift. So what that means, talking about the upper body lift, is the incision was basically designed to border the pec muscle, the lateral border of the pec muscle and the bottom of the pec muscle.
Right.
And that's where you remove the extra skin. And then
so in a lot of guys, that's a natural crease anyways, right? If you've got
so
a
it
defined
hides
pec
very
muscle.
well, especially if you scar well.
Yeah.
And then we did a free nipple graft.
Yeah.
And he looks freaking awesome.
That's awesome.
I mean, he lost 250 pounds. He did this all through weight loss, through, eating healthy and exercise. And he's actually really buff and in shape. He just had all this extra skin.
Hey, don't talk trash about Ozempic.
I like Ozempic.
Some of us needed a boost.
I like Ozempic. I like Wegovy. I like...
Mounjaro. Yeah, I'm not on Ozempic.
Mounjaro.
But,
But he looks awesome.
Yeah.
I mean, I can't wait to do an interview with him and highlight him for our practice, because it's just incredible to be a part of his transformation.
Did it lighten him up? Did it, in terms of his attitude toward the world, kind of just give him a huge psychological boost?
It has so far. I mean, he's able to.
I mean, it's got to.
He was telling me yesterday, the day before, he's like, I never have worn jeans.
Yeah.
Because when I wear jeans, I have to put it over my tummy that hangs over.
Yeah.
And now he can wear jeans.
Right.
And just wearing jeans.
Yeah.
That he was never able to do since he was a little kid.
Take it for granted. There's so many things that we take
How
for
old was
granted.
he?
He's it's like 42, I think.
Okay.
Young for you and me.
Super young.
Old for Dr. Zoog. Young for you and me. Right? 42. So
Real
much,
young.
So much knowledge to just.
Can he go out on his own at night?
I don't know if he can buy beer. That's I don't know what the age is now. So gynecomastia is one thing, obviously.
But that incision would be an unusual thing for most men.
Correct.
Most it's around the bottom half of the areola.
If even that, maybe even just some liposuction incision.
Yeah, I mean, Vasor's made it to where I can get away. You know, I'd rather, if somebody has leftover gland there that you can feel after you've done Vasor liposuction, sure, make a little incision, pop it out. That's great. I mean, one thing that we all talk about is you don't ever want to over resect, right? You over resect and give somebody a saucer shaped deformity or something where it looks like their nipple is like sucked in, and an indentation is never any good. But yeah, I mean, you're talking about being able to get rid of this tissue through a couple of little 2 millimeter nicks in their skin. And yeah, they're bruised, they're sore. I did it a couple of weeks ago, and then the wife actually told on the patient when she came here for something else. She's like, I know you told him 2 weeks not to exercise. He didn't exercise for like
typical man.
3 days, right? Doesn't follow instructions, the opposite of what most women who follow instructions and are great and don't want to screw anything up, men think they know better. So
where else, if we're talking about breasts for men, that's gynecomastia, what other places do you find men have liposuction?
I mean, for guys, we got that spare tire, right? That we just kind of hate. Yeah, the hips, lower back, kind of that area.
Lower back.
Yeah, nobody likes a muffin top. I mean, muffins are delicious, but muffin tops aren't. So, and that's a great thing. And male fat's different, right? I mean, male fat isn't typically this white, fluffy fat that just comes really easily. It's typically more fibrous. So, I use Vasor liposuction on everybody now, but specifically for men, I mean, that was one of the reasons why I think I was doing so many more male liposuction cases that got me to just kind of think about, I've got to introduce this kind of Vasor component to it to make it easier, because it was just hard on me. I mean, hard on the patient too, because
when you say hard on the patient, what is the typical recovery for liposuction for a man?
Well, I mean, I think it's the same for a woman, right?
And what does that look like?
Everyone's kind of different with their pain tolerance, but usually a couple weeks of bruising and swelling. Swelling can kind of stick around for a few months. One of the biggest things in plastic surgery that has really come on is lymphatic massage.
Oh yeah, critical.
And it's very important. And to be honest, when I was in training, we didn't offer that. I mean, we were at a big university center.
Yeah.
So we didn't really have all that set up. But just from all my patients, I've been doing it here, and huge difference.
So you're in compression garments and you're drinking tons of fluids, right? And that's going to help you. You're bruising, all that. You're right. Some people bruise like a peach. Some people are pretty stoic.
But you're done with the bruising in a week.
Sure.
I mean, I found a lot of people didn't bruise at all.
Yeah, and it also depends upon the magnitude of liposuction, right? I mean, if somebody comes in and you're pulling 5 liters off them, it's going to be a different, recovery than somebody who loses weight through diet and exercise and has a little extra around their midsection, which is certainly the most popular area for guys. Abdomen, Mons area, people do. I mean, we're typically not really looking at our thighs too much or anything like that.
Yeah, different than women.
Yeah, arms, guys don't hold a lot of fat in their arms.
Mostly abdomen, hips.
It's mainly just that kind of abdominal tire. The tire, exactly. So I do want to touch point on one thing. I know where I stand, so I'm kind of putting you guys on, and it may be different than you guys. So I'm kind of putting you guys on the spotlight right now, sorry, but abdominal etching, right? Or the idea where you're coming in and you're wanting a 6-pack, but you don't want to work for it. You want your plastic surgeon to make a 6-pack for you by overzealously liposuctioning a grid pattern, a liposuction pattern on
waffle iron.
Yeah. And so, I don't mean to speak for the practice. We're all 3 different plastic surgeons, and we all have our different ideas and philosophies and things like that. I'm staunchly against abdominal etching. I think that there are areas that you can liposuction more for people to help define areas, but the idea of breaking all the rules of liposuction and, making a permanent deformity. Yeah. And
I think you just said the most important part is you're defining their anatomy.
Right.
You're not etching a 6-pack into them. If you're doing that, then I think you're doing them a disservice.
Yeah.
Because as we age, things sag, and it doesn't stay the same. I mean, I've seen some pretty incredible, after immediately after on the OR table results of these kinds of cases.
Well, you just said it perfect. Immediately after.
Right.
And that's exactly what happens. Like, I was joking around with somebody demonstrating to him how social media and plastic surgeons, and I've got a good friend who's in Miami who trained at Duke, who is a wonderful plastic surgeon who does you're Chapel Hill guy, who both of you, who does a lot of Brazilian butt lifts, and he gets great results, and I trust him, right, because I know him. But there's a lot of guys who they've got this before picture and the patient standing up and they may have some extra fat and look a little dumpy and they're clenching their buttocks and they're up against a wall, and then they have their procedure done and they're jackknifed with their rear end up. They've, the camera angle is from the foot of the bed looking at this, so everything kind of elongates in that direction. They're throwing baby oil and putting different lighting on there. It's crazy. It's a gimmick. It's a hoax. Sure, you can get improvement in some of these patients, but I think with the abdominal etching scenario, I think that you're seeing a lot of early results before patients age, before their skin lax comes into play, and they're just left with little pads almost of fat to simulate what a six-pack should look like. And I just think that ultimately over time it looks terrible. When it scars in, it becomes a major issue for people. So I think early results look far better than, longer results.
I think there's a difference too with, when I do liposuction, if someone has an athletic build, I like to define the midline. I like to define the linea alba and the semilunaris, basically where your ab muscles in a little bit, and really follow the anatomy. But as far as the really, liposculpture etching kind of thing,
but those are two areas.
I just don't think that.
Right, but those are two areas of the body that tend to have less fat, right? Like it's like our groin area as well. I mean, God made us without any fat in our groin so that we could sit here in these chairs and we weren't like bumping into it, right? So, I mean, those are like areas that I think you can help define. But I think that like the whole, hey, let's make a six-pack grid across things, I think it's fraught with disaster. I think you're going to have major problems down the road. So I commend to my male patients, let's get you kind of how the human body is supposed to be. And if you want to work off more weight, if you want to help kind of your own situation, then diet and exercise, right?
Better candidates get better results.
Right. Abs are made in the gym and shown in the kitchen.
There you go.
That's what everybody says.
How about, what do y'all think about male dermal lipectomies?
I think they're great. It's typically the massive weight loss population that we're doing these to. And a dermal lipectomy is removal of skin and fat. So it's, you may think of it like a tummy tuck. Rarely do men need their muscles brought back together because we don't have pregnancy. But we certainly can have diastasis, but it's just kind of a different scenario. I think how quickly a woman stretches and then has to go back, I think that challenges that midline diastasis more than if a man just kind of gains weight slowly. I mean, ultimately, a woman goes from looking the way she does prior to pregnancy to a pregnant tummy in a matter of, 9 months, 8 months, 7 months, however long it is until they quote unquote pop. But for men to gain that much weight, it's typically over years and years and years and years. And so I just think that it stresses the tissues less and there's less need to do the tummy tuck muscle plication component to it.
So that'll make it easier on a male just to take the skin and fat away?
100%. It's easier recovery. And I think that's often combined with liposuction, just like in the female population.
And where would that incision go?
In their underwear line.
So that they could wear a Speedo at the beach or the pool and not have it seen?
Sure.
In your Speedo, could be hiding your Speedo?
I could wear my Speedo at the beach.
Would color matter at all for that incision?
It's red.
It's red. Good.
Yeah, mine's
It's a
leopard
visual.
print, so it's just
Leopard print.
Yeah, my wife would tell you I'm sunburned is what I am because I'm so stupid that I forget to put sunscreen on like a good plastic surgeon. Yeah,
Okay.
yeah. So that's my look at the beach. It goes really far in my family. Everybody's great, right? We went on a trip. My wife and I went to Mexico a few months back, which was great. And I remember it had been a while since I had been out in the sun. So I was like, you know what? I'm just going to 30 minutes. It's cool. Like, whatever. You can't get too damaged in that. So we stayed out, and then place had a great spa. I went in there. I cold plunged. I did all the, the hot tub and all that. And that was like before, like there's that zone of time where you're like, I see a little bit of color, but nothing's crazy before it really just kind of turns on you. I remember ripens. And so I was sitting there in the spa, and one of the attendants came in, and he was so great.
Put your pants on,
no,
sir.
Yeah, please. Well, it's kind of odd that I have to ask you a second time, right? No, I'm standing there, and he's like, oh, Mr. Harper, you're sunburned. Let me get you some aloe. And it was just, I felt so humiliated. I was like, here I am, the plastic surgeon who's supposed to take care of all these things, and I'm not. I was as red as a beet, which was terrible. So I think you brought it up a little bit as far as like the dermal lipectomy and the liposuction as far as recovery goes. So a lot of people will say, is there any difference in recovery between a man and a woman? And I would say, yeah, there's a huge difference because men are wimps. And like women handle pain way better, right?
That's true.
So the only difference, there shouldn't be.
I was going to say there's no difference.
Yeah, theoretically.
But no, it is.
Yeah, there is.
Yeah.
Men are going to, I'm so sore. Can I have more pain pills? Women are like, I've already gone back to doing all of my mom duties because my husband's terrible. And so kids have to eat and get to their plays and their soccer and all this kind of stuff. So, we're in jest. Like, no, the human body is the same. It's the same time frame of healing. It's the same process of healing. It's the same. If you've got incisions, you want to take care of them with tape,
But without
scar gel,
muscle
do all
repair,
that. Right.
it's
much
a lot easier.
That's exactly right. Yep. Skincare,
Oh, love that.
Botox and filler, right? Or we can call it Brotox so that everybody feels better about it, right? Filler, if you need it, is great. As we get older and we lose volume in our face, men and women, it's great to restore that youthfulness with some filler. The cheek area, the jawline, these are all areas that men get defined with filler. And I think it does spectacularly. If people say, I didn't see a result with filler, it's because you didn't use enough. It's that simple. Botox is one of these things where, I don't know, Evan, you're the youngest one here, but are you doing Botox yet?
I am.
Okay, and how young are you?
36.
All right, I'm 46 and am using Botox. Forehead, frown lines. I do not touch my, what do they call these bad boys?
Crow's feet?
Crow's feet, because I think that's distinguishing in a man. Or at least I read that, like maybe George Clooney said that.
I think the receding hairline is exceedingly distinguishing.
I think so too. And you are a
Exceedingly
little
far.
older than us, but still do Botox, and skincare is hugely important. Something that
Well, I've been doing skincare for probably 30 years.
Right.
And Botox in the
What do you
90s.
do for your skincare?
I think, like most guys, I'm not going to put 5 different things on twice a day.
I think that's what discourages men
I agree.
from starting a
So
yeah,
in the morning,
5-in-1 shampoo in the shower.
exactly. No, a lot of Head and Shoulders on your face.
That's it, everywhere. That's right.
No, but there's a product we sell called Daily Power Defense, and I use that. It's got an antioxidant. It's got a epidermal growth factor. It's got some other stuff I can't remember. I put that on in the morning, and then at nighttime I put a retinol on, and I use retinol because it's got 85% of the effects of retin A and only 5% of the downside of flakiness, dryness, redness, that kind of thing. So it's very well tolerated. And sunscreen. So I do one thing in the morning, one thing at night, and sunscreen, and it's very doable. Yeah. And I can tell you, looking at my friends, my skin is way better than all the old guys I hang around with.
Evan, you still just use an Irish Spring, or what do you do for that youthful face? What do you do?
That's it. It's just Dove.
So I use...
I tried the products when the reps give them to me, and I definitely see a difference in like them. But
So I just keep a bottle. They have a little travel size, and then they've got a bigger pump size. I use Revision, the facial brightening wash. I think it's fantastic.
That is good.
And then at night I'll do Redavance, right, which has a little bit of retinol in it, and something for my under eyes, just so a little Revision DEJ or something like that, and that's it. Like, I don't think you need to go crazy on things. Certainly if I'm going to be out in the sun,
I think,
and I'm being responsible.
I think you are playing right into their hands. I think that retinol is the same on your cheeks as it is on your eyelids, but go ahead and do it.
Yeah, I just feel, I like it.
Okay.
Makes me feel like I'm addressing a problem, right?
Okay.
Yeah.
And who makes the product that you use in the morning?
Daily Power Defense, I think, is ZO.
ZO.
Yeah. Mm-hmm. It's a tube, about that big and and a couple of pumps and you're out of there.
Well, I guess I'm going to have to start doing that.
And so then what?
I don't want you any better looking than you already are, all right? So back off.
So my, I used to have like deep lines across my forehead before I started doing Botox.
A knife wound across my forehead.
Yeah, I mean, I remember looking at pictures in my 20s, and I would have lines. And so when people say Botox can't get rid of static lines that are just there if you're not animating, I disagree with that.
Totally
I think if you do Botox and you prevent, the book page from getting folded and creased over and over again, your skin with good skincare will regenerate and will get rid of those fine lines.
Absolutely does, but then you stop doing it and they come back.
100%. And that's one thing you got to commit yourself to good skincare. And along with good skincare and regimens that men can do and Botox and filler, the same thing happens with lasers, with RF microneedling. All those things can improve upon male skin texture as well. And we're a little different. We've got beard lines. We've got tend to have bigger oil glands and things like that, bigger pores. So the good thing is that we've got an amazing skincare team and an amazing nurse injector team that can take care of all those things for you, which is great. We see more and more men that come in here every month than the previous month, which is pretty
I tell the
phenomenal.
ladies, and you all probably agree, that for me, skincare for your skin is like exercise for your muscles. And you're better off working out every day. You're better off doing just something to your skin every day than either not doing it at all or every now and then do a 10K, or in the skincare world, that'd be every now and then do a chemical peel or something like that. The daily stuff's way better than occasional treatment, and certainly better than nothing.
One of the main things that I think I have enjoyed and is also kind of a part of my regimen is for hair restoration, right? Like I always kind of thought I had good hair, always liked my hair, and then
way
as
too
it
much.
starts to recede, I don't know about that. But as you start to get little areas that recede, there have been a whole bunch of different technologies that have come out. Years and years ago, you took a pill, you took a finasteride, you took one of these things that was supposed to kind of block the testosterone conversion to 5-DHT, and so you were presumably trying to help those hair follicles sensitive to that degradation from falling out, right? And that's the male pattern baldness that people see. And just like women are now doing way more hair restoration with PRP, PRF, exosome therapy, that kind of stuff. I feel like it's one of these things that you need to do a daily routine on, or you're not going to get the same result, whereas I feel like people were drawing blood and doing PRP and injecting that in the scalp and getting some good results. I feel like if you're adding the things like the Nutrafol shampoos and the Nutrafol pills and helping, enrich those hair follicles with what they need, it's just like taking care of your lawn. Got to overseed, got to fertilize, got to aerate, got to do all those things. It's a maintenance. So if you're doing that every day and using your shampoo and using your minoxidil drops on your hair and taking your vitamins and coming in and doing either PRF or exosomal therapy with Kristen Hall, all those things, you are going to grow new hair. And it's, I don't know, it's great. I think that that's one of those avenues for men they're insecure about. And I think
would I like to have hair? Absolutely.
You got a great shaped noggin, though.
Well, that's the benefit
and
of
so that's
lucky, but
that's lucky.
I mean, having a lot of hair would be
those,
nice. Am I right?
Right. But for those of us that felt like our hair was one of our best defining features, it's something you want to do everything you can to try and hold on. Yeah, absolutely. And obviously go to a great stylist like Aria Vargi, who's fantastic. Shout out to him. And so, all right. So we've talked about the most common surgeries, realizing that there's plenty. If it bothers you, just like our female patients, if you have a definable situation that can be addressed through surgery, we do all of those, which are what's fantastic. The most common of which is going to be liposuction, removal of skin and fat, and massive weight loss.
You do a lot of blephs, though, in men.
Absolutely. Oh, eyes are huge. Yeah. Facelifts are huge for guys.
Yeah, probably more eyes than faces.
Yeah, I agree.
The faces have the challenge of the beard, but if you turn around and look at it as an advantage, you can hide your incisions by growing your beard out for 6 or 8 weeks, by which time the incisions have kind of faded to barely perceptible. You shave the beard off and people go, oh my God, you look so much younger without your beard. And it is a great way to disguise what you've done and a good plausible deniability.
You know, we went over the surgery. We went over the fact that Botox and fillers are also great for men. It may take more, right, in a man's face, and certainly for structurally, it may take more volume, more, and, you know, I've kidded around with our nurse injectors. If my arms or legs were as strong as my corrugators, which are the muscles between.
You'd be a frog.
Oh, I'd be so strong. I'd be like, frog. I got a funny story about a frog, actually. I'll tell that joke on another podcast one time. But yeah, and so it may take more for a guy to get, you know, the result that they need. So you just have to be understanding of that. Skincare is critically important. As we talked about, your routine may be different than the three of ours because you may have different skin. So that's why you come see an expert, one of our estheticians who takes care of skin all day, every day, and can help shrink your pores, can help shrink your oil sebaceous glands, can help get rid of rosacea, can help really improve things to where your fine lines and wrinkles are getting better and you look younger, and you know, people aren't looking at you when you're walking into a restaurant like, oh man, his wife, poor wife.
What is that with his daughter?
Guy? That's exactly right. That's bad, right? I mean, my wife happens to be a little older than I am and looks 20 years younger. I think that's mainly genetics, but we'll see. Or I tell her it's not the age, it's the mileage. A lot of miles on this. But really that's it, you know, and the hair restoration, which is awesome. And exosome therapy is kind of even the new craze in hair restoration.
Tell them what exosome therapy is.
So exosomes are basically signalers, cell signalers that different companies harvest their exosomes from different places, right? These are typically, and it can be from plant-derived, it can be from humans, and so the ones that we use are human-derived, and these are taken from somebody who's donating them, just like you donate blood. And so exosomes are then treated and injected into areas. You can microneedle them into the hairline, but exosomal therapy is going to signal the pathway for regeneration of these areas and for new cells to be formed. And from a hair restoration standpoint, I think, you know, obviously the exosome companies tell you this, that in head-to-head competitions, it's can be even more advantageous and better results without having to draw blood that you have to do for PRP or PRF therapy. Now, the drawing of the blood's not a big deal, right? You get 10 cc's, you hold your 2 fingers over the little place where they drew blood for 2.5 minutes, and then you're done while it's spinning down. But, I mean, it's nice to not have to do that if that's an issue, and we have all those therapies here, and so...
No, the one thing we don't have here is hair transplantation.
Correct.
So we have a place to send folks.
Sure. I mean, there's places here in town that that do hair transplants, which can be necessary, right? They typically will transplant an area of the scalp not affected by male pattern balding, which is affected hormonally. And so if they transfer those hair follicles that aren't affected hormonally, then they should last for forever.
So that's back of the head, sideburn area. Well, not sideburn, but temple area.
Yep.
Just normal hair-bearing areas throughout your whole life.
You're rarely seen, back in the day when they used to put tissue expanders on the skull and like expand the hair-bearing area and then just kind of advance it over. That's not really being done.
I think it's because transplantation is so good.
I think it's gotten fantastic. Yeah, there's some great places to go do that, but that's when you're too far gone. And PRP, exosomal therapy, PRF, it can really ignite hair growth in people who may think that they're too far gone. And it also works for women too.
Oh, women
which
are
is
a big
pretty
deal.
Great. Yeah. Well, we're going to kind of wrap up. Any other closing thoughts as far as guys go? This is guys do it too.
Well, I probably should say males do noses as well.
Absolutely.
For breathing.
Yep.
The convex bump on the nose is a masculinizing trait, so not as many men will object to that as women do.
Right.
But sometimes we'll take those off and make them just straight, which is a good-looking nose. Talked about eyelids, talked about facelift. Not very many brow lifts because a lower brow is acceptable in men, and you don't want to feminize a male face by raising the brow up. So we don't do a lot of those. Yeah. And I don't think we do very many lip implants on men because, again, a feminizing feature.
Right, but maybe sometimes chin implants can help harmonize
definitely chin implants,
face and jawline and all those things. So, there's a ton of areas of plastic surgery, cosmetic surgery, skincare, all that kind of stuff that's really applicable to men. So I would commend to our male audience out there and even the female audience, tell your man, because you deserve to be standing next to a good-looking dude,
Absolutely.
Like, we shouldn't be the only ones that are sitting across from beauty. Our wives should do the same.
It'd be selfish not to do it.
I feel like it's a disservice.
To your wife.
It's disrespectful.
Exactly.
It's disrespectful. All right. Well, if you have questions or topics you'd like us to cover, please visit our website, www.ghsurgery.com. Click on The Doc Dudes from the homepage. There's a link to submit questions, ideas. You can also listen to all of the Doc Dudes episodes on our website, as well as Apple, Spotify, YouTube, or anywhere you check out your favorite podcasts. Please follow us on Instagram, Facebook, find out when new episodes are dropping and other information about our practice. But I think this was a good talk about, getting men involved here. And so we look forward to seeing more male patients. And hopefully if you've got somebody that, I guess you could just kind of drop the hint by just starting the Doc Dudes podcast when you're in a car with your husband or male partner, right? Just kind of be like, I don't know, let's just listen.
Well, if your guy's starting to bald up and you're worried he might be concerned about it, if you're a lady, you go, honey, I'm worried about losing some of my hair. What do you think I should do? Oh, we can do it together.
All right, we appreciate you, and we'll see you on the next episode of The Doc Dudes. Bye.
Bye.